So basically, it loses 15% of its budget, $415 million a year, which is a very significant sum. So it can't be that it can operate at the same level. To me, I'm still an advisor, but I'm not employed by the WHO. I'm an oncologist in London, and it's very, very sad that Trump has used this political message, this political football, if you like, at a time when it's not about a blame game. We've got to resolve this whole issue together, and the WHO is the only international agency we've got. There's no one to step in. No one's going to want to step in either, and it's a really hot seat. Tedros Ghebreyesus, who's the current director, very talented guy. He was foreign minister in Ethiopia. He was the health minister in Ethiopia. He's a physician by training. He understands it all, and he's surrounded by great experts. I think there have been mistakes, and the mistake was at the beginning, and that's what Trump is seizing on. But his problem is trying to justify the mess that the United States is in after, this is a country that spends $1.9 trillion on healthcare, that have the finest healthcare facilities in the world, and yet it's in a real mess with corona.
Yes, and the cases continue to peak, as we mentioned, 56,000 today. And that's what's interesting to me, is what impact withdrawing from the WHO will actually have on the US, and it's the information the WHO provides right around the world.
Well, that information is all freely available, so it's not going to not get to the US. They're not going to be cut out and blacklisted and all the rest of it. But I think it's just very sad they're no longer. 194 countries are members, all of us, Australia, UK, we're all members, and we all pay according to our population size and also our relative wealth. So, of course, the American contribution, the North American contribution is huge. Big population, big global product. So clearly, moving forward, it's going to have to cut programs. And WHO has a very powerful educational message for many parts of the developing world. So for diseases such as diarrheal disease in children, which kills more children for that one thing that can be cured with $10 of salt solution, basically. It's a bit more sophisticated than that, but that's essentially it. For $10, you can save the life of a child. And to go with that, you have to have educational packages, not just for health workers, for barefoot doctors, and for parents that may not have any education at all, but can quickly learn how to deal with a sick child. So those sort of programs, which the WHO is very good at as part of the United Nations, will suffer because of it.
Yes, will be impacted. Trump has said that they're pulling out because the WHO has become China-centric. If China should step in to compensate for the lost funding, surely that just gives them a greater upper hand.
I would have thought so. I mean, it was very sad when you look back, and many have looked back at what happened in January. The Chinese did hide things. There's no doubt. It was, and everybody would. I mean, you don't suddenly, if something goes wrong in your house, you don't go rushing out telling everybody you've done something dreadful. They didn't realize, I genuinely believe the Chinese didn't realize the seriousness of what was happening in Wuhan in those really heady days of January in this year when the pandemic was coming out. And it was going on the air routes around the world. That was what was happening. There were 2 daily flights direct to Heathrow, London's main airport, from Wuhan directly. The virus was on that plane right back then. And if they'd notified the WHO then, hadn't hidden stuff, we'd have been on top of it, I think. And it may not have got so widespreadly distributed. But what's done's done. This is not the time to cancel the subs to the WHO. We do need international health organization of some sort. And there's no one else standing up willing to come forward.
I'm interested too in how the organised management of countries getting access to drugs or vaccines that are developed down the road, and what role WHO does play in it. I mean, we're seeing remdesivir, the US just buying out all the sort of global stocks of it. Is it going to be that disadvantaged countries just won't get access to these kinds of medicines?
You see it in my specialty, cancer. The US actually uses 75% of the world's supply of cancer drugs, and yet it's less than 5% of the world's population. So that's sort of crazy, really, but it's all financial. And of course, they use the expensive drugs. Poorer countries use essential drugs, not so expensive, but probably not necessary and tailored to their ability to spend. The WHO, again, has a huge educational role for politicians to show health ministers how best to get value from different aspects of healthcare. You know, I remember arguing with the health minister in Gambia a long time ago. He wanted a breast cancer center. What he needed to do was get rid of hepatitis by injection, because hepatitis by immunization in children, because that causes the commonest cancer in his country. And he didn't want to do that. He wanted him cutting the tape for a breast cancer center. And I couldn't persuade him otherwise. So there you go. But the WHO does have a role to play in balancing political decisions as well.
Yes, the challenges remain. Karol, always lovely to get your perspective. Thank you so much.
And you.